Technology is becoming a great help to the care of HIV patients. Certainly internationally and in remote areas, it has helped folks who don't have access to HIV specialty services get access.
Patients who enjoy the technology and the speed and the breadth of information and contact and community that it affords them are going to expect their doctors to also.
The AAHIVM award in technology is important because it supports a growing area of medicine that is enhancing clinical care. Importantly, it funds pilot programs that have the potential for sustainable funding in the future.
I think it's an extremely important award to encourage young investigators to study how technology can be best used to serve patients.
Telemedicine is the use of telecommunications and computer technology to bring clinical care services to remote sites. It's been traditionally used and defined for international sites or rural sites where there's a great physical distance. We're also using it now in the urban setting where there are several roadblocks that essentially create a meaningful distance for patients. These include psychosocial issues like competing needs like mental health, substance use, housing and transportation issues. The UCSF HIV telemedicine program is a program that links UCSF Medical Center to 3 community clinics and 2 community-based organizations that provide care to HIV-positive individuals, in particularly underserved communities. For example, we're able to take the expertise of our pharmacists and our nutritionists and our HIV psychiatrists and share them with these sites through telemedicine in a way that is both cost-efficient and time-efficient.
Historically, it's been very difficult to recruit young gay men into research studies. So we thought it would be innovative to try and use some of the newer technologies which were being ruled out that young men who have sex with men were adopting very early to try and provide HIV messaging. We started by looking at a mobile phone application called Grindr. Young gay men use this for friendship, for dating, but also for sexual partnering. What we essentially did was we used the chat function that's built into this application to go out into the community and start chatting up people on Grindr and saying, will you come meet us and take a quick survey? They told us an incredible amount of detail about their sexual risk behavior.
We plan to use funds from the AAHIVM to build on our existing urban HIV telemedicine program.
We're hoping to use it to pay for someone who is sophisticated in technology to help us use not only Grindr, but other cutting-edge technologies as they come out, to have a group such as AAHIVM being willing to take a risk and support this kind of work is critical.
Merging technology with clinical care allows us to reach people where they're at and not just wait for patients to come to us. And I think that is the wave of the future of medicine.